Well, there's also good news to report on the COVID-19 pandemic, as the Minister of Health, the Honorable Renwood Wells, outlined the decline in COVID-19 cases in a national statement yesterday that also includes news that government has planned to use a well-known treatment for the virus. The United States-based Federal Drug Administration announced on its website the October 22nd approval of the antiviral drug remdesivir for use in adult and pediatric patients for COVID-19 treatment. Now, the FDA warns that the drug should only be administered through injection into a vein at a hospital or a healthcare setting. Also known as Veklury, it's the first treatment for COVID-19 to receive FDA approval. With no official vaccine yet created, Health Minister Wells announced that the Bahamas will now venture into using remdesivir to treat COVID-19.
The Ministry of Health is also in the process of securing therapeutics and can announce that we have already procured 150 doses of remdesivir. As additional therapeutics are approved, we will aggressively seek to procure the same.
Now, one of the primary COVID-19 prevention tools in the Bahamas are the Emergency Powers COVID-19 Orders protocols, like the current weekday 8 p.m. to 5 a.m. curfews in New Providence, Grand Bahama, and Abaco, and the full 24-hour weekend lockdowns in New Providence and Abaco only. Health Minister Wells credits this for the recent decline in COVID-19 cases. In a national statement Monday, he revealed that health officials now record 45 cases daily instead of the previous 90 cases per day. Over the past few days, health officials, he says, reported 21 and 24 confirmed COVID-19 cases respectively across the country.
It is noted that this reduction is by no means a result of a decrease in the number of tests performed. The national testing protocol has not changed. Our experience has been that predominantly those who are symptomatic present for testing. Contacts of positive cases are tested only if they become symptomatic. Based on the current national testing protocol, we expect that the demand for testing would also decrease. In Epi Week 40, 928 COVID-19 tests were performed in country. In Epi Week 41, 2,331. And in Epi Week 42, 1,011 tests were performed in country.
The health minister also confirmed the positivity rate over the past 2 weeks decreased from 32 to 12%. The World Health Organization recommends the positivity rate remain below 5%. Contact tracing has also been a successful strategy, with more than 111 contact tracers currently in the pipeline.
Hospitalization among persons testing positive for COVID-19 have reduced dramatically as well. 85 persons with COVID-19 were hospitalized across the archipelago, down from the high of 122 hospitalized persons on October the 22nd.
The health minister also confirmed the positivity rate over the past 2 weeks decreased from 32 to 12%. The World Health Organization recommends the positivity rate remain below 5%. Contact tracing has also been a successful strategy, with more than 111 contact tracers currently in the pipeline.
Hospitalization among persons testing positive for COVID-19 have reduced dramatically as well. 85 persons with COVID-19 were hospitalized across the archipelago, down from the high of 122 hospitalized persons on October the 22nd.
The health minister also thanked all public and private healthcare professionals, Samaritan's Purse for assisting the Ministry of Health in its greatest time of need, the competent authority for his decisive action, and all other stakeholders who have worked tirelessly to fight COVID-19.
I laud efforts of all concerned. I thank each and every one of our citizens for enduring the preventative measures and helping to control the spread of COVID-19.